Obsessive Compulsive disorder, or OCD, is a common, chronic, and long-lasting disorder in which a person has uncontrollable, recurring thoughts or obsessions, and behaviors or compulsions that he or she feels the urge to repeat over and over. Obsessions can have certain themes, such as fear of contamination or fear of dirt, doubting and having difficulty tolerating uncertainty, needing things orderly and symmetrical, aggressive or horrific thoughts about losing control and harming yourself or others, unwanted thoughts including aggression or sexual or religious subjects. Some examples can be a fear of being contaminated by touching objects that others have touched, doubt that you've locked the door or turned off the stove, intense stress when objects aren't orderly or facing a certain way, images of driving your car into a crowd of people, thoughts about shouting obscenities or acting inappropriately in public, unpleasant sexual images, avoidance of situations that can trigger obsessions such as shaking hands. Some factors that may increase the risk of developing or triggering obsessive-compulsive disorders include having a family history, having stressful life events, or having other mental health disorders, such as anxiety disorder, depression, substance abuse, or a tic. Glutathione is known as the body's master antioxidant, and it has many functions. Several lines of evidence support the hypothesis that lower brain levels of glutathione are associated with increased oxidative stress, and this may contribute to obsessive-compulsive disorder. Numerous factors can reduce your glutathione levels, such as deficiencies like selenium, or depletion due to toxic load, such as mercury poisoning from mercury amalgam tooth fillings. There's some ways to increase your glutathione, like consuming reduced glutathione at doses of up to 1,000 milligrams per day, taking N-acetyl L-cysteine, the glutathione precursor, at doses of 500 milligrams 3 times per day, taking the herb milk thistle, and also ensuring that you get selenium, example by consuming 3 Brazil nuts per day. Vitamin B12 deficiency is a commonly overlooked cause of psychiatric and even some neurological illnesses. Common neurological psychiatric illnesses associated with B12 deficiency are dementia, neuropathies, depression, and irritability. Authors concluded that obsessive-compulsive disorder was an early manifestation of vitamin B12 deficiency. You can take B12 in the form of methylcobalamin in an oral sublingual form under the tongue. And you should realize that a blood test for vitamin B12 may not be accurate, as food is now fortified with folate, and this can give a false reading on the B12 blood test. As B12 is a water-soluble vitamin, it's generally considered safe when compared to fat-soluble vitamins. A multi-B vitamin is essential for creating dopamine, epinephrine, serotonin, and myelin. They also help the mind to focus, they help hemoglobin hold oxygen, and lower cholesterol. Vitamin Bs are essential to good health. They're also used for energy production in the human cells. B vitamins help convert food, which is consumed as carbohydrate, into fuel. They also help the nervous system function properly. Taking a multi-B complex alongside with a B12 supplement can enhance the action of the B12. There are cases of psychosis resulting from a thiamine vitamin B1 deficiency. Therefore, also adding an additional thiamine supplement to the multi-B and the B12 could be beneficial here. Methylation. DNA methylation regulates gene expression by recruiting proteins involved in gene repression or by inhibiting the binding of transcription factors to DNA. The precise regulation of DNA methylation is essential for good cognitive function. It's important to note that any DNA methylation that occurs as a result of stress or some environmental factors can lead to the onset of obsessive compulsive disorder. Therefore, learning more about epigenetic alterations of DNA through DNA methylation is crucial in understanding obsessive compulsive disorder and anxiety disorders. Undermethylated people tend to have more obsessive compulsive tendencies and controlling behavior, addictiveness, and can also be quite aggressive. Severe unshakable delusions and brain fog, etc., are also typical of people who are undermethylated. When it comes to undermethylation, 90% of those on autism spectrum are undermethylated. 95% with antisocial personality disorders are undermethylated. 90% of people with schizoaffective disorder are undermethylated. 85% with oppositional defiance disorder are undermethylated. 82% of people with anorexia are undermethylated. And 38% of people with depression are undermethylated. Some supplements that can help with undermethylation, as well as the B vitamins, are D-L-methionine and SAMe. A higher L-methionine dose is required than SAMe. Patients also improve with zinc, vitamin C, calcium, magnesium, and vitamin B6, and inositol sometimes helps with sleep problems. Treatments, however, can take months before an improvement is noticed. D-L-methionine is much cheaper than SAMe. Also, the supplement TMG, or trimethylglycine, extracted from sugar beet, provides the same benefits as SAMe at a fraction of the cost. Therefore, trimethylglycine and D-L-methionine may be your best options for this. Decreases in homocysteine and MDA suggest a potential role of MSM in supporting metabolic processes requiring methylation, such as antioxidant capacities. MSM is an organic sulfur compound, and it can be taken in doses from 5 to 30 grams per day. Detoxification is to be expected, so starting with a small dose may be the best option, and then working up to a higher dose over time. There are many other benefits attributed to MSM. The detoxification symptoms of MSM can be reduced by taking it alongside vitamin C. You want to take a liposomal vitamin C or a non-acidic vitamin C, not highly acidic ascorbic acid. Garlic is also another sulfurous compound, and it can help people with undermethylation. In a study on 48 patients with obsessive compulsive disorder, when compared to 48 healthy controls, it was found that serum zinc, iron, and magnesium levels were decreased in the patients with obsessive compulsive disorder. Only food source iron would be recommended, as synthetic forms are now shown to be bad for health. Zinc, such as the form of zinc picolinate at doses of 50 milligrams per day, can have numerous benefits, such as activating enzymes and helping the immune system. Oysters are one of the highest zinc-containing foods, and it's the zinc in oysters that get it attributed to its sexual benefits. The best form of magnesium is magnesium bisglycinate. In order to determine your dose, slowly increase until stomach discomfort and diarrhea are noticed, then gradually reduced to find your maximum tolerable daily dose. As magnesium is required for hundreds of enzymes to properly function, it can have profound benefits after a few months of supplementation. It may also help balance and reduce the abnormally high levels of calcium which are found in patients with OCD. Uridine is naturally found in breast milk, however it's now synthetically created as a supplement. Uridine plays a critical role in the pyrimidine metabolism in your brain, so in simple terms, uridine monophosphate promotes neuron and synapse growth and DNA repair. Some benefits reported by neurohackers include uplifting and stabilizing mood, reducing stress and obsessive compulsive disorder, and a reduction in anxiety, and a modulating and normalizing effect on dopamine release. Uridine monophosphate is the best form due to its price and the scientific evidence backing it up. Doses can range from 150 milligrams up to 2 grams per day. It works synergistically with omega-3 and choline in the creation of new synapses in the brain, improving its function. Users also report an increase in verbal fluency from consuming uridine monophosphate. Theanine is extracted from green tea. L-theanine supports neurocognitive function in several ways, supporting both neurotransmitter functioning and brainwave activity, and in the case of obsessive compulsive disorder, it helps to calm the brain. L-theanine modulates aspects of the brain's function in humans by increasing alpha brainwave activity, which calms the brain. Doses can be anywhere from 100 milligrams per day up to 1 gram per day. Oxidative stress describes oxidative damage in a cell. The level of oxidative stress has been found to be much higher in the fat cells of people with obsessive compulsive disorder. Antioxidants protect cells from oxidative stress, so vitamin E and vitamin C are both antioxidants. People who are affected by obsessive compulsive disorder have been shown to have significantly deficient vitamin E levels and also slightly deficient vitamin C levels. You'd want to take a mixed tocopherol food form of vitamin E for best results. Valerian officinalis is a well-known medicinal plant with a long history of use in the world for its effect on GABA receptors. A study that was 8 weeks, which was double-blinded randomized trial, where 31 adults who were diagnosed with the DSM-4's criteria for obsessive compulsive disorder were interviewed and participated in the trial. And this trial assigned either a capsule of 750 milligrams per day of valerian or a placebo for 8 weeks. The results suggested that valerian had some anti-obsessiveness and compulsiveness effects. 5-HTP, or 5-hydroxytryptophan, is a naturally occurring amino acid and a chemical precursor as well as a metabolic intermediate in the biosynthesis of the neurotransmitter serotonin. Clinicians around the globe for more than 20 years have successfully used amino acid precursors, including 5-HTP, for the treatment of obsessive compulsive disorder. It's recommended to start patients with 50 milligrams of 5-HTP and then slowly increase every 2 weeks up to a maximum dose of 200 milligrams per day. Researchers examining the ability of CBD to treat obsessive compulsive disorder is still in early stages. However, some studies have found evidence that CBD may help to manage symptoms, and many people anecdotally report that they find it helpful. CBD is generally safe and rarely causes any dangerous side effects. You can see my other video on CBD for information about the mood-altering benefits of CBD supplementation. Though the amino acid taurine doesn't directly target the neurotransmitter serotonin, it's still worth noting that it has inhibitory effects, and this may reduce racing thoughts associated with anxiety disorders like obsessive compulsive disorder. Doses of taurine can be 1 gram taken 3 times per day. Inositol, or more precisely myoinositol, is a carboxylic sugar that's abundant in the brain and other mammalian tissues. It mediates cell signal transduction in response to a variety of hormones, neurotransmitters, and growth factors, and it participates in osmoregulation. It plays a role in how neurotransmitters work in the brain and throughout the body, including reversal of desensitization of the serotonin receptors, and as such, inositol may have beneficial effects on anxiety and obsessive compulsive disorder, similar to serotonin uptake inhibitors. Doses of inositol can be 2 to 4 grams per day. Like most physical and neurological imbalances, the lack of sleep is implicated, so improving sleep can have a great benefit to a wide range of conditions. Alterations of the circadian secretion of melatonin have been reported in obsessive compulsive disorder. In medication-free individuals with obsessive compulsive disorder, the nighttime peak of melatonin concentration was shown to be markedly reduced in comparison to controlled subjects. An individual's dose of melatonin can vary greatly, therefore it can take trial and error of slowly titrating up over time to determine the optimum dose for each individual. Other methods of improving the circadian day-night body clock can be to reduce caffeine and sugar, to remove electronic devices from your bedroom, to use blue light blocking glasses, to make sure that you wake up when it's bright and you go to bed when it's dark. Be sure to check out my other video on herbs and supplements that help to promote a proper sleep. And you can also check out my other video on schizophrenia, as similar brain mechanisms may be involved in obsessive compulsive disorder.